Hello, my name is Deirdre Anderson, and I'm going to be talking about the unstably housed population's oral health and how it relates to their quality of life. As we start, let me introduce you to the unstably housed population. According to the United Nations, over 1.6 billion people worldwide live in deficient housing. This population suffers from many untreated dental and medical conditions. Most of them have barriers keeping them from accessing care, such as cost, logistics, such as transportation, but above all, the mistrust of medical professionals. This is due to a variety of negative prior experiences. With their lack of medical understanding, it lends to unreasonably high expectations of the medical providers. They've expressed feeling overlooked, and they have perceived negative attitudes from the medical staff, which leads to them feeling stigmatized and marginalized. The unstably housed population is at an increased risk of dental conditions, such as active dental decay, periodontal disease, and oral cancer. These conditions negatively affect the health and functionality of the oral cavity, leading to psychological and physical disruption, and therefore lowering the quality of life. Poor oral health has a direct relationship to lower oral health related quality of life. For my project location, I chose Acts Homeless Ministry, which is a church organization that opens up its facility on the first and third Saturdays of each month and provides services to the homeless and working poor. These services include bus passes and gas cards, showers with fresh clothing and hygiene packs, haircuts, hot meals to eat there and take with them, extra donated clothing to grab, reading glasses and sunglasses. There's also a nurse that's there to check blood pressure, blood sugar, and answer any questions they have. Also, they get a 2-week supply of over-the-counter medications and supplements. Many steps went into setting up this project. First, I contacted the facility, and they set me up with Terry, one of the staff members involved in running the event. Then, I went in for an observation to introduce myself to the population and ask them what they thought would be helpful to set up a dental table. I then researched assessment tools in order to properly measure their oral health related quality of life. I obtained donated and purchased materials such as gloves, masks, and so on in order to set up my oral cancer screening table. I then discussed the logistics with Terry to figure out the location, including tables, chairs, access to the internet, TVs, and power sources. Also, I needed a volunteer helper and running water. I then created materials such as the pocket guide, video playlist, and questionnaires, and I researched local clinics in order to create a resource list for all reduced rate dental facilities for the pamphlet. And then I finally printed out all of the surveys and questionnaires. I chose the Oral Health Impact Profile 14 assessment, a 14-question survey designed to evaluate oral health related quality of life. Each question is answered from 0 to 4, with 0 being never and 4 being daily. At the end, the scores are added up, and the closer to 0, the better the quality of life. I also created a questionnaire to be administered before and after my educational presentation. The answers were written in one color at baseline and another after the presentation. A volunteer was trained and filled out the answers. I came up with a lesson plan that laid out what my volunteer and I were to be doing, what the participant was to be doing, how long each section would take, the rationale for each step of the plan, and what we would need for each step. Here's an interview for the Acts Ministry social media site right before the project started.
Hi, my name is Deirdre Anderson, and I'm a student with MCPHS College. It's an online university where I'm getting my master's degree in dental hygiene and public health. And today I'm going to be working with the homeless and working poor in order to try to help establish the home care, and also trying to figure out where what and how oral cancer looks like. I've created a little pamphlet to kind of help with different things regarding all of that. And then also at the end, I've done some research in order to find some clinics that are currently available as of July 2023 that the homeless and working poor can get reduced rates in dental care, and there are emergency services available at any of the red highlighted ones where they'll be able to get the help that they need in order to get out of pain and get back on track.
The room was set up in two stations, one where the oral cancer screenings were performed and oral hygiene instructions were given, and the other was for the video and evaluations. During the project, a list of videos containing oral conditions and basic home care instructions were played on a loop in the background while I performed oral cancer screenings. I provided the answers to the questionnaires while I had the patient follow along in the mirror. My project, as with most, did not come without challenges. For starters, no one would call me back. I reached out to dental and medical clinics and homeless community centers, but I could not get anyone to set up time for a meeting with me. Next, I'm a dental hygienist, but not an affiliated practicing dental hygienist, so there were only a limited number of things that I could do and provide to help the community. Also, being the only hygienist, I could only work with one person at a time, which made it time consuming for anyone that was waiting to be seen. With that being said, the facility was set up in stations in different rooms, so people would saunter in as they felt like stopping by, which made it hard to plan and control for larger groups. Lastly, the facility was only open from 8 to 11 on the first and third Saturdays of the month, so there was not a lot of time to do research in the location and run the presentation considering the shortened semester. On to the results. After collecting all of the data from the surveys, I calculated the average answers to each of the questions and organized them on a table and graph. The top 4 ways that poor oral health affected the unstably housed population's oral health related quality of life were discomfort with eating and that life was overall less satisfying, followed by embarrassment and most frequent feelings of self-consciousness relating to their teeth, mouth, or dentures. All of the top answers were averaged in the fairly often to daily range. The OHIP 14 is divided into 3 aspects of life, with the top answers affecting all of them. The overall average answer to each question was 2.24, meaning the unstably housed population surveyed stated that their oral conditions affected the quality of life from occasionally to fairly often. Their average overall score was 31.29 out of 54, with 0 being unaffected by their oral conditions. The questionnaire answers were graded at baseline and after the presentation. Only one person had the answers correct at baseline, whereas after the demonstration, almost everyone answered correctly, leaving me to believe that the demonstration was able to successfully educate the target audience. During the oral cancer screenings and oral hygiene instructions, I had many conversations with the participants. One of the most common themes of the conversation was bad past experiences due to the attitude of the medical professionals. They felt that they were not receiving proper care because the professionals seemed preoccupied or rushed, and they weren't listening to their concerns. These experiences created mistrust of the professionals and left the participants feeling leery to ask for help unless it was an emergency. Moving forward, it is important for us to remember that these people are coming to medical professionals for help. Many are anxious, scared, or even embarrassed, so it is our job to actively listen and put them at ease, educate them about their conditions and what options are available, regardless of their background. The unstably housed population has its own special needs that we as a profession need to work together in order to fulfill them. This project definitely changed my perspective towards the homeless and unstably housed population in regards to their oral care. I'd like to personally thank Terry at ACT Ministry for all of her help, which would not have happened. Also, the Writing Center for helping my paper come to life. And I'd like to thank all of you for taking the time and sharing this presentation with me.